There we are. Hello, everyone. Thank you so much for joining us today. We are here at the International OCD Foundation's official Facebook page and YouTube page. Today, we are focusing on the topic of body dysmorphic disorder. As you know, currently going through, the whole nation obviously is going through and internationally with the COVID-19 situation, and it is affecting people in many different ways, including those with different mental health difficulties. I know there's been a lot of focus on how OCD has been affected during this time, but we also know that the body dysmorphic disorder community is also struggling. So we are excited to be able to address those issues. Today, it is not only about us. We all on this panel have body dysmorphic disorder and treat it. But we also want this to be a community and an open chat. So feel free at any time to leave comments and questions. And even if we're talking, make sure to leave some and we will jump into those questions, answer any questions you may have. We want to remind you that this is absolutely a safe space. This is a community space. So make sure that you're there for each other in the comments, and we'll be there for you as much as we can. But we just want to give you an opportunity to reach out, to ask your questions, and just let us know how you are doing during these tough times. We definitely want to remind you that this is a safe and confidential space, that we can help you as much as we can. Obviously, it's going to be public, so it's not confidential, but it's definitely meant to be warm and supportive. So what I'd like to do first is introduce everybody on the panel, just so you can get a little bit of background about us. And I would love to start with you, Scott. So why don't you give us an introduction?
All right. Thank you, Chris. I also want to thank the IOCDF for putting this together. I'm really grateful to have this opportunity. Just very briefly, as you said, I too am a therapist, specialized in treating BDD and OCD. And I have had BDD myself since, well, it's been a very long time, since the 1970s. So I do have the perspective, as you said, of somebody who treats it and someone who has lived with it. And I'd like to say somebody who has recovered from it. I wouldn't say that I'm symptom-free, but I certainly have gotten to a point where I'm able to manage it very effectively, to the point where I don't feel that it interferes with my life right now, which is great. All right, I think I'll stop there with an introduction.
All right, how about for you, Robyn?
Hi, my name is Robyn Stern. I am based in New York. I'm a therapist. I also have BDD. I treat BDD and OCD. I've probably had BDD since I was in college. And the IOCDF is just a great place to get out the information and talk, be a good forum for people to talk about BDD and where to get the right treatment. And so I'm so grateful to be here today to talk.
Thanks, Robyn. And how about for you, Thomas?
Hey everybody, I'm Thomas Smalley, in Connecticut. I'm a strength and conditioning coach. I'm going to grad school soon, so I'm in the exercise science field, and I've had BDD and OCD diagnosed since I was about age 15. So I've spoken at conferences before, and it's really great to be here last minute, and I can't wait to get started.
Thank you. And my name's Chris Trondsen. I also was diagnosed with body dysmorphic disorder, but I suffered since I was a young child. I was fortunate, like many people on this panel, to receive proper treatment for BDD. And like Scott had said, I consider myself in recovery as well. And now I treat body dysmorphic disorder, OCD, and related disorders in Southern California. And I'm just excited. I see some of the comments, people saying hello. So once again, just a reminder, we're going to have a couple hot topics that we're going to get to, but we definitely want to open it up for everybody in the comments as well to ask any questions you may have. Just what I'd like to do to start off is, obviously all of us, even if we treat body dysmorphic disorder, also have it ourselves. And I think right now, either ourselves or our clients are going through a special kind of set of struggles and difficulties during this time. And what I'd like to do is open it up to all of you, give you about 3 to 5 minutes, just sort of let me know, how is it personally affecting you? And maybe how do you see it's affecting the community? You guys can get as personal as you'd like and open up as much as you'd like. So let's start with you, Scott. How is body dysmorphic disorder affecting you at this time? And then if you'd like to go into how you're seeing it affecting the community, whether it's your clients or other people you speak to, I'd love to hear from that as well.
Sure. Chris, I'd like to start, though. I omitted a moment ago saying that I'm located in Northern California in Redwood City. So I mentioned that, I'm in recovery with BDD, but it's certainly not gone. And what I've seen for myself is very similar to what I'm seeing in a lot of my clients right now, which is for me, one of the main coping strategies has always been to maintain as much control as I can over the mirror use. Like so many people with BDD, the mirror hasn't been my friend. And so when I'm at my work, typically what I will do is that I won't look in the mirror at all during the day. If I have to use the restroom, I just go and I just don't look, because I know that if I look, it's probably going to involve some compulsive checking. So I just don't do it. And that's worked out very well for me. Now, one of the challenges in doing therapy these days is I'm on the internet all day long, and usually using something like Zoom, which means that I have to look at myself all day long. And frankly, that is a challenge. And I know for some of my clients who have decided not to do therapy during this time, they have done so in part because of that, because looking at themselves on the Zoom image is too triggering. Now, I realize that you can just sort of disconnect the video portion of it, but even so, many people have been very uncomfortable with it. So what I do for myself is basically do my job. I try to focus just on my client, keep the attention focused that way, and try not to spend much time looking at myself, because I know that I mean, frankly, it's been some exposure therapy. And it's worked out pretty well, but I know that I still do get triggered at times, and so I do have to be careful for that. So I do find for me that that's the biggest challenge, as well as not just the Zoom image, but also the mirrors at home. I mean, there are plenty of opportunities to go look in the mirror at home if I wanted to, and I do try my best during the course of the day just not to do that. And so for me, that's been the most important thing, is being careful with the video images and with mirrors.
And how about your emotional toll? Having, as a therapist, you're having to provide for others, but now you've just opened up how your lifestyle has changed. You aren't looking at mirrors all day, but now you are looking at your reflection. How about just as a person, like emotionally having to do basically exposure therapy throughout the day when maybe it wasn't affecting you as much? Like, how is that taking kind of emotional toll on you as a person?
Well, in general, I would say that I have coronavirus fatigue. That I'm really tired of this thing, and I mean, tired of being at home all day long. I mean, that in itself is exhausting. And I think that one of the things I've been surprised about with doing Zoom therapy, I think it's more exhausting than in-person therapy. I think it does require more focus and more attention. And it's sort of surprising to me. I wouldn't have guessed that, but I find that hour after hour doing this is really quite tiring. And so, I do try to schedule myself in a way that I hopefully I can maintain my mental health some, but it hasn't been easy. And one of the things I do try and tell myself, as well as my clients, is that every day that passes, we're a day closer to this thing being over. And I think to be able to take a day at a time attitude with this is really important. None of us know when this is going to end. And I think just to be able to take it a day at a time is the way I'm coping best.
Yeah. And real quick, maybe for some viewers that either maybe think they have body dysmorphic disorder, or maybe they have OCD and are joining us, could you give us just a quick synopsis of, just diagnostic criteria, or just a general overview of what body dysmorphic disorder is?
Yeah, I mean, for BDD, I mean, certainly BDD and OCD look a lot alike. And I think for the layperson, if you describe BDD as OCD about physical appearance, that is one way to put it, although there are some very important differences, which we don't really have time to get into now. But with BDD, the obsessional thinking is all about physical appearance, and usually it's about features around the face and the head. And so people who obsess about their hair, like, that's been my thing for almost 50 years now. But hair, eyes, their ears, their skin tone, but it can truly be any part of the body. And along, just like with OCD, I mean, there is the compulsive point of this too, where typically there are a lot of compulsive behaviors. And so, I mentioned the one that's most common probably, which is the mirror checking. But there are others. There are a lot of people with BDD go the opposite way and just avoid mirrors altogether. Some people take down all the mirrors at their home. There's a lot of comparing behavior. And this is where, I know a little bit later we may talk some about social media. And this is where social media can be a big problem, where people compare themselves to how other people look. There can be the overuse of cosmetic products and pursuit of plastic surgery, which is a significantly dangerous form of compulsive behavior. And there's also what's called camouflaging, which is covering the body part in some way. You know, if you're worried about your size of your stomach, let's say, you may wear very loose-fitting clothing, or if it's about acne, maybe overuse of makeup, or having to wear your hair in a certain way. So it can look a lot like OCD, but the one way to think of it is that if you're obsessing over a part of your body in terms of how it looks, then you probably have BDD.
Thanks. And Robyn, before maybe you go into how it's personally affecting you, as well as your clients, a lot of times people think body dysmorphic disorder is like vanity or typical, maybe people really care about their looks. How do you kind of discern the difference between general preference of keeping yourself looking a certain way versus when it becomes body dysmorphic disorder?
So oftentimes, even myself, when I was struggling, I felt that I was repulsive. I felt like I didn't deserve to be out there. I felt that I didn't deserve to live a life. I didn't deserve to have friends. I didn't deserve to be in a relationship or be loved. So it goes beyond just appearance. It goes beyond how you feel about yourself. And you feel like you're not worth it. You feel like you don't deserve. And you feel like you're so different from other people. And so it's definitely not a vanity thing, because it really has, yes, it looks like that on the outside, but so much of it is an internal struggle. And I think one of the things, is this value we put upon ourselves. Most people with BDD, the way that they kind of see themselves in the world is based upon what they look like, based upon their perceived defects. And oftentimes it's really magnified. It's not exactly how they're viewing it. And it's really hard. And so I think that for people that are struggling, and for the outside people, they don't really understand it. And while it may look like OCD of the physical appearance, it goes a lot deeper to the core of who a person is. BDD really affects their social and emotional growth, and really can affect other things beyond the compulsive behaviors. It really affects the person, who they are. It's to the core of who they are. So it's a very serious disorder that really needs the proper treatment that goes beyond, I believe, even exposure therapy. It really goes on to look at who you are, how you view yourself, not just in the exposure work and just the compulsions, but truly how you've now taken on that because I look a certain way, I don't deserve things. And then even if you get over doing the compulsive behaviors, you still might not feel like you're worth it. And so I think it's working on all those things as well. And so it's definitely much more than vanity. And, even getting surgical procedures or even doing, camouflaging really won't take away from that inner feeling that you're not worth it and that you aren't good enough.
Thanks. And how about, thank you for that explanation. I think that will help a lot of people that are watching understand like what BDD really is, both you and Scott's description. Can you get a little into how personally, like how currently the COVID situation, the quarantine, I know you're kind of in the heart of it where you live because you're in New York, right?
Yeah.
You're in like the heart of it. How has that been for you? How has it affected BDD and your mood? And then also your clients, but I'd love to hear first just kind of personally how it's affecting you.
So also I'm in recovery as well, but it brings back actually being home. It brings back when I was struggling in the sense to be isolated again and to feel that sense of home, being homebound, which when I was at the worst of my illness, I couldn't leave my house. So to feel that that's kind of where we are again, it just makes me realize like I was in this situation, and it's scary to me sometimes because kind of similar to Scott, like really making sure that I have my coping strategies, making sure I don't give in to going into the mirror, making sure that I don't start to go down the path of Googling and looking for cosmetic treatments. My issue was around my skin. So making sure that I kind of stay on track with all of that. But I think and I've noticed even with some of my clients as well, like staying home is very difficult for them because it brings up a lot of the stuff when they really were struggling. For so many people, again, trying to build value outside of their appearance really is about living their life so being home, that's taken away from them. So I think it's really important we talk about scheduling, what we can do for routine. And for some people, they're in small apartments and small living spaces, so we don't have the opportunity of being in a bigger house where they have other things to do. And so I really find during this time that for myself, even so, like it reminds me of like that maybe 15 years ago when I never wanted to leave my house. And it really it's a little bit traumatic to think about those times. I'm obviously grateful to be where I am right now, but I have to be, even myself in recovery, have to be diligent not to be drawn back into the mirror, not to be going back and doing things that can really hurt myself. And I think one last thing is also like, how are we going to get back out into the world after this? So I think those are some of the things that have been going on with me and with my clients as well.
Thank you. Thank you so much for being personal and opening up. I really appreciate it. And then how about for you, Thomas? Like first, how is it affecting you as a person? Are you still doing any kind of treatment, and how is that affecting the BDD? And then lastly, I've been fortunate to know you forever, and I know you also deal with muscle dysmorphia, which, is also image related. So maybe you could, give us a little bit of definition and also explain how that's affecting you. So I'd love to hear just personally, how is this currently affecting you right now?
Yeah, absolutely, Chris. I think especially, what Robyn was saying, the isolation piece, it kind of reminds you of, when you were at your worst and you didn't, like for me, I didn't really leave the house. I didn't really go anywhere. So it started, the first 3 weeks, it was kind of like, okay, like I can deal with this. And it's kind of, to take it day by day situation. But then it's like, okay, this could be life for the next few months. How are we going to go about this? How am I going to, combat my BDD and kind of, make sure that I'm not relapsing and going in a backwards direction just because of being isolated at home. So it kind of took a turn at week 5 for me, just kind of realizing that, I was at school finishing my senior year in Albany, New York at Siena, and I went home for spring break early March and didn't go back. And then, now I just finished undergrad and I start grad school in August. But I'll move to Boston. It's kind of just, the next 3 months, just kind of realizing that, this might be life. And, for me, it was tough because as a strength coach, training is kind of, what my life kind of revolves around, training athletes, training myself, and then to have gym shut down, to just be kind of thrown into a situation where you have to kind of make lemonade out of oranges per se, kind of work with what you have. That was kind of an interesting situation for me, and kind of being able to adapt and kind of being back with my parents and realizing that they have lives too, and I can't be irritable or kind of getting in the way of their work, as well as, trying to not relapse with my BDD. And especially you mentioned like muscle dysmorphia piece for me. I know Scott said it's, a lot of times it's touching your face and hair, ears, mirror, things you see in the mirror. But for me, BDD has really taken a toll on muscle dysmorphia in that aspect. And, not having the same equipment, whatever it is, not being able to train every day like I was the past, whatever, 6 months. And, that was kind of part of my daily routine. That was kind of tough for me to just be thrown into a situation where, here's what you have, like you have to adapt now, or you're just gonna, you're gonna relapse. And but then also making sure that you're not crossing the line of being obsessive with your approach, and that's what I've been kind of working on with my therapist. I've been doing Zoom therapy as well, and I agree with Scott, it does take a lot more focus, but it's really taking you back to the times where you couldn't leave the house, and when my therapist would do home visits, it's getting to the point where I realize I need to have the same discipline, same approach, because by week 5, and really it was starting to have reminiscence of when I was at my worst. And I realized I need to make sure I'm being diligent with my maintenance and with my ERP and therapy with on Zoom, and really at the time ready to go, ready to attack therapy or on Zoom, even though it's taking us all through a whirlwind. I think one of the worst parts is that there's still so much uncertainty. We don't have answers of when life will be exactly back to normal, when stay-at-home orders will be lifted. We don't have those type of answers. So it's kind of, like Scott said, for me, I got into a routine. I think that's definitely helped. I know I was talking to you about that earlier, Chris. Just getting into a routine and staying busy, that definitely has helped. And just finding new ways to train, and then also just realizing that OCD and BDD hate uncertainty, and that's what this situation really is. And it's sucky. It really is. Nobody asked for this situation, but we kind of have to adapt and roll with it. And I think that the more you work with the ERP and your therapist, that you'll be able to deal with the uncertainty.
Yeah. Well, thanks. Just to give you a little heads up, there's a little bit of you kind of like freezing up a little bit. So I don't know if there's a better place in your house that has better reception, but it was freezing up a little bit.
Okay.
Yeah, I just want to give you the heads up. I'll go next. I mean, both what Thomas and Robyn and Scott said, I mean, I can definitely relate to. I think the biggest thing, Robyn, what you said is what has hit me the hardest is the way that my life looks like now was exactly how my life looked like when I was at my worst. So it was isolating, being housebound. I mean, I only left my house for a 3-year span. I lived at home, did not leave the house except Sundays to go to a 24-hour grocery store in the middle of the night. So the least amount of people could see me, and then buy the supplies for the week. And that's pretty much what our lives look like now, is we don't leave the house except to get essentials for the week and stay home. So for me, it has been this very eerie, kind of like flashback or deja vu, and I don't like it. I don't like that. I mean, part of the whole point of treatment was to get to a point where you could just freely live your life. And so it almost feels like I was promised something and now it's been taken away from me. And obviously, I have an understanding why we're doing it. There is no part of me that's rejecting why we're doing this. I mean, my heart goes out to every single person that's affected by this. I personally, even if there's not somebody personally in my life that it's affecting, as of right now, I still, my heart goes out for everybody, and for New York, for California, for every place. But at the same time, like, it's really been a struggle for me just to kind of mentally understand that what my life looked like at my worst is how I'm living now. And I notice for me, especially days that I'm not seeing clients, which right now is only Sundays, but on Sundays I have to keep myself busy because I can find myself just sitting in my place. I live alone. And it reminds me, it flashbacks to being isolated. And that's been really, really difficult. And I would say, the other thing has been what Scott pointed out. Like, as a clinician, I'm on video, telehealth the entire day. And I feel like I'm doing something naughty or wrong because my clinician was like, you don't look in the mirror unless you need to. Meanwhile, all day I'm just staring at myself. And, our focus shouldn't be on ourselves. It should be on our clients. And so I've really worked on being mindful, definitely focusing, so, making sure that my window is so small that I'm not distracted by it. But that's been hard because it gets really easy to fall back into old habits and start to look at myself and how is my face? Is it symmetrical, this and that? And it's like, no. So I think, like Scott, like you're saying, is I'm starting to have to pull back on some of those, or pull up some of those old tools that really helped me during my struggle, and making sure that it's 100% on point right now. I think the other thing is for me, part of my general self-care is seeing people. I'm an extrovert. And so that's been really, really hard as well. And then lastly, for me, fitness and exercise, I never had muscle dysmorphia like Thomas does, but I definitely had image concerns around my appearance and my waist. I mean, the body dysmorphic disorder definitely hit my face the most, but there's certain body parts like my hips, et cetera, I didn't like. And so not being able to work out the way that I normally work out has also been affecting me. So it really is, like you guys have said, is like those tools. The great news is the tools that we get in therapy work for a lifetime, even through pandemics. Now you can put on the CBT ERP box, like, works through pandemics. So it's been proven because it's been helping me, stay on task and make sure that it's not affecting me to a point that I'm crumbling. As for the community, I'm vice president of OCD Southern California. We get a lot of emails and Facebook messages, as well as my clients. And like Thomas, I mean, there's a lot of clients I work with who have muscle dysmorphia, and for them it's really difficult because they don't have the level of weights and equipment in their places, especially if they're in a little apartment, et cetera. And so for them, their brain is fixated on the fact that their body weight exercises isn't what it used to be. And then clients that have BDD, for some of them, the isolation has been really affecting them. a lot of their treatment has been getting out and being around people, and now that's been sort of taken away. There's not really a way to do that consistently and safely, so that's been hard. They feel like their treatment has kind of been ripped from underneath them. Also, you know, obviously the goal is to get away from any kind of like surgeries and cosmetic fixations, but some of my clients aren't there yet, and they can't get some of their they can't visit their dermatologist, or they can't get their normal skin products and are having to use other ones that they find at Target, and to their brain that's not good enough. So they're really struggling with this adjustment, and they're having to kind of jump into a level of exposure therapy that maybe we were going to work up to. They're kind of thrown into it. So that's how I see it affecting the community. And I'm just glad that we're having this, obviously, to support. Before we go into some of the hot topics and stuff, we do have a question. I think it'll be good for the panel. It's from Sarah H. So we have Jess. Hopefully, I was supposed to private message her, so hopefully she'll see it, but it's at the 10:12 mark. Sarah asked, does health anxiety sometimes fall into BDD, especially if one is obsessed over particular body parts? So my guess, yeah, my guess is, and she could clarify in the comments if she has any extra clarifications, but my guess is that she maybe fixates on a certain body part for health reasons, and she wants to know if that's the same as body dysmorphic disorder.
Well, I can answer that.
Okay, Scott, why don't you go?
I mean, BDD, health anxiety, OCD, they all look a lot alike. But there is an important distinction, of course. I mean, when it comes to BDD, we are talking about physical appearance. I mean, if the concern is primarily about health, then it would be considered health anxiety. Now, I realize there can be a lot of overlap, and there's nothing saying that the same person can have health anxiety and BDD and OCD for that matter. Robyn, you're raising your hand.
Because that's me. I have both.
Oh, okay. All right. So that's all I have to say about that part of it.
And I wanted to say, actually, because I have both, that I used to look at health anxiety as the internal type of BDD, like you're so focused on all the physical aspects of what you're feeling, the psychosomatic feelings. But it's a little bit different in that, like I said, I feel like with BDD, we're viewing ourselves as, like, when we see our distortion, we feel like we're defective in that way. Whereas I don't think when I have health-related anxiety that I feel defective. I'm more scared that something's going to happen to me. I'm not necessarily feeling like I shouldn't go out there or put myself out there. I think maybe sometimes people with health OCD or health anxiety would not want to go out there for fear something's going to happen to them. But I think it's a little bit different on what their major concerns are.
Yeah, no, I think both of you hit it right on the head. I dealt with health anxiety as well. The only time I would say maybe there was like a blur is my main body dysmorphic disorder focus for a long time was my skin. And so it was hard because I was going to a dermatologist, and some of them I feel took advantage of my fears until I found a good one. And so they were presenting it like a health concern, like, oh yeah, you have a lot of bacteria, your skin isn't clean, here's all the products you need. And so for me, it blurred a line. Like, it felt validated because I was having doctors say, yeah, you have a skin condition, you need to do these things for your skin. And then it turns out when I finally saw a dermatologist that didn't take advantage of me, she's like, no, you have fine skin, you don't need to be doing all these things. So to me, that's where it kind of blurred. But yes, I also had health anxiety on different body parts, and it was never about its appearance or its right. Disformities. It was more so, is this pain going to go away, et cetera. So that's why I think, like you know, Scott kind of said, sometimes it can feel like it blurs a little bit, but that's how I would make the distinction, what you guys said. We have another question. It's from Jeannie R. And she says, how do you find the strength to keep working at beating OCD and BDD when you feel like you're relapsing? So I think that's a really good question. I know I was going to talk about it later, but I'll bring it up afterwards. There was a really good article that you shared with me, Robyn, on the IOCDF's BDD website, where they give some tips of how to stay above the water. But how about for you guys, either personally struggling with BDD yourself, or as some tips that you're giving your clients? Like, how do you guys stay motivated and find that strength, especially if you feel like maybe you're relapsing or can't do your treatment to the full extent that you were doing prior to this?
Well, I mean, for me, and I think for people I know who also have BDD, you have to know your triggers. And I think most people with BDD know what their triggers are. and just to be mindful of that. I mean, BDD is always looking for ways to make our lives miserable. I mean, we know that, and we know that if we let up just a little bit, that can happen. And so for me, again, it's just being very mindful of, of like the mirror checking. If I find myself that I'm combing my hair and I'm moving around just a few hairs in my head thinking makes a difference, then I know I'm in a danger zone, and I have to walk away. And I realize that that's hard. I mean, the walking away from the compulsive behaviors is a hard thing to do, because we're doing that in an attempt to get ourselves to feel better. And one of the problems is that the compulsive behaviors do work sometimes for brief periods. I mean, they do. It could be 1 out of every 50 times, 1 out of every 100 times, but we know that there's a possibility they might work. But it also means that 99 out of 100 times they don't work. And so you're much better off experiencing the discomfort of resisting the compulsive behavior than you are giving into the compulsive behavior and then dealing with the aftermath of that. And so I do think for me and a lot of my clients, the idea is know your triggers, stay away from them, and have a schedule during the day. Keep yourself as reasonably busy as possible, and to be as productive as possible. One of my clients said to me not too long ago, which I think was terrific, is that she said she often thinks in terms of how does she want to remember this time, and how does she want to remember how she coped during this time. And I think that that's a really valuable way of looking at all this.
I like that, Scott. I mean, one of the things that I'm trying to tell people is if you can really stick to the program, you can really stick to, the treatment program that your clinician and yourself came up with. If you can get through this, the nice thing is like, now you're set. I mean, afterwards, obviously there's going to be other triggers, but if you can manage it during these times, I think it makes you so much stronger that when I think of it as like, this is up here. So every normal life thing after this, you're going to already have had the tools of really reducing compulsive behaviors around BDD during a pandemic. I mean, it doesn't get pretty tougher than that.
Tougher than this, right?
How about for you, Tommy? Maybe for you personally, like how have you been able during these times as a patient right now? You're still seeing your therapist for BDD and OCD. How are you staying on task with the exposures and the treatment that your therapist has come up with so that your BDD stays at bay?
Yeah, so I mean, honestly, I was kind of just like Scott, I kind of realized my triggers, and there's certain points where I'm like, okay, this is definitely not rational, kind of trying to decipher that rational and irrational brain of 150 more reps on something is probably not the correct way to deal with BDD or muscle dysmorphia. And that's probably not going to help me. It's going to hurt me in a long time. I know as a strength coach, it's going to hurt me in a long time. So we're going to walk away. Just things like that. And then also, I went back to my roots. I went back to going, seeing my therapist on Zoom, but going back to the hierarchy and going to, telling her what my compulsions have been, what my obsessions have been. And then, I actually have it in my room right here. I taped it to my wall.
Oh, very good.
Tacked it to my wall. It's
Great.
Literally it's my chart of, each day, my anxiety scale, realizing, over time how it gets better. I think those are things, I think especially staying motivated, set short-term goals, because those short-term goals turn into long-term goals that you can achieve. And then also seeing that progress, I think that really helps too. Visually seeing that, okay, my anxiety was at a 10 this day. Now, 2 hours later, it was at a 6. And then the next day when I did it, it was started at an 8, and then it was down to a 4. Just seeing that change in your anxiety, it's visual proof, and that kind of registers with my brain at least that, it's getting better. But just, I know that I can't be a good college strength coach and work with student athletes if I can't be on the floor with them. And I know I won't be able to go to grad school in Boston in August if I don't make sure and live on my own in an apartment if I don't make sure that my OCD and my BDD is under control. Right? Recovery is such a strong word, because I know for me, this is chronic. This is something that there's going to be ups and downs. There's going to be better days. There's going to be worse days. But knowing that I can live a functional life, and making sure I'm at that point always is the most important thing.
Can I just say, as a therapist, like I get chills when people have their stuff in their room, like have their like tracker or ERP sheet or homework sheet. Because as a therapist, when I was in treatment, mine was right smack dab on my fridge. So there was no way I couldn't do my exposures because I would be called out by my family because I was there in public. So whenever I have clients be like, "Oh my God, it's on my fridge or in my bedroom," I get chills because that's our dream, that they don't go home and just like crumple it up and like throw it away.
Right. And I think also like it's an accountability thing, right? You know, I know myself, you know, I tend to avoid, you know, and that's an OCD behavior, compulsion is avoidance. And I think having it on my wall, you know, I wake up and I see that, I know what I have to tackle for the day before I can go do my actual tasks that I have to get done for the day.
Absolutely. Well, and I like what you're saying is just that accountability, going back to the basics. That's always the best thing. If you're feeling lost, go back to the basics, reconnect. I really like that. How about for you, Robyn? How do you stay motivated and how do you stay energized through these difficult times?
I think for me, it was about 6 or 7 years ago, finally accepting the BDD as Thomas said, like with being a chronic. For me, when I've had the relapses and I would get better with working through therapy, I would act as if I didn't have BDD anymore. So some of the strength that I have and I try to give to my clients is that I accept that I have this. Now, I don't allow BDD to take me out of my life like it did. I look at it as like when you're driving a car, BDD used to be in the front seat driving, and now it's in the back seat. But I think for me, and I talk about the strength, is that I actually feel stronger admitting that I have it. That also holds me accountable to my behaviors. So I think it's important when you're feeling like you're relapsing, it's about looking at it. Okay, maybe you're having a hard day. That doesn't necessarily lead to a full relapse. I think holding yourself accountable to having this disorder and looking at it as chronic will hopefully keep you maybe day to day on board with doing the behaviors, because we're all seeing ourselves, even though we're in recovery, we're all seeing ourselves as therapists still using our core, tools. And so for me and for my clients, I try to really, not to say that BDD is going to take them out of their lives, but that this is chronic and this is something that we have to deal with day in, day out. What are our triggers, like Scott said? Like, what do we have to do? And so for me, owning it has been tremendous and has honestly helped me from having a full relapse again. Because one of my biggest issues with my therapist who passed away, Dr. Hyman, was like, you would pretend like you didn't have this disorder. And that was actually holding me back. So while it's a very hard disorder, it's something that could be treated with the right treatment. You can live a full life. And also a relapse isn't the end of everything. I think so often when we feel like we're relapsing, we lost everything. What I found with myself and with my clients, that as soon as we get the tools back going and we start going down the hierarchy again, we get back all that gain again. So I think it's just about working with the right therapist, having the right team together, and just realizing that you're worth it. You deserve to live a happy life where your appearance is not dictating your life. And, it's a struggle each day, but it's worth it. And we know that we can get to the other side of things.
Yeah, all really good points. I know for me, I think a why is the most important. To stay motivated, to stay on track, there always needs to be a why. Like, why am I doing this? Why am I working hard to get better? My why currently is I want to stay on top of it because I'm working with clients and I want to make sure that my stuff is taken care of so that I can give to them. But that's probably not going to be most people's why that are watching this and that need support. So really figuring out why, because it is always sometimes easier to just kind of lay down and give in to the compulsive behavior. So really working on making sure like, why am I doing this? And having really reachable goals. A lot of times people, when they hear like chronic or they think about treatment forever, they're just like, okay, I want to give up. But instead, recognizing you can use that instead as a motivation. Like, this is something I'm going to be dealing with for most of my life. So let me work harder. Let me beat it before it beats me. But I think having very like tangible, reachable goals that you could do each day, like exposure goals. Like today, if somebody's looking in the mirror maybe 25 times on average a day, they can have a commitment to say, okay, tomorrow I'm going to keep it at 15. I'm going to keep track of it. I'm going to make sure I know how much, and I'm really going to commit to 15. And if it doesn't work, I'm going to get with my clinician. We're going to talk. We're going to strategize. Like, how do I get that down? There was a really good article that Angela Fang wrote for the BDD website for the IOCDF. And most of the points that we talked about ourselves is some of the things that she suggested. So just lastly, to give Jeannie some final support, but maintain a typical routine. I don't know if you guys agree, but I know I'm telling people, like, go to bed and wake up around the same time that you normally do, eat your meals normal time, just have some kind of structure. I mean, do you guys agree with that? Like, have you found that structure is helping?
Absolutely.
Yeah. I think for me, I was like, oh, it's a snow day, and then I was like, oh, it's day 7, and this is like the next 6 months, so it's back to structure.
Yeah, I think a lot of people are going to bed really late, 4 in the morning, and then sleeping all day, and that just does not work. That messes with so much going on. The IOCDF also put a link to the article that we're discussing in the comments if anyone wants to click it on themselves. We also talked about, like Tommy was saying, going back to ritual reduction strategies, going back to your hierarchy. We talked about conducting daily exposure challenging, practice the big picture. So, we were talking about recognizing like this, COVID-19 situation may go on for a while, focus on the day-to-day, set goals for yourself. And then, like you were saying, Tommy, like making sure that you have access to a clinician, even if you're doing it through telehealth. But I think you made a good point, Scott, earlier, that some people, for clients, telehealth either is too triggering or they don't feel like they're getting the same support that maybe they would get in person.
Right. One of the things I wanted to add, Chris, is that in the current IOCDF newsletter, there's an article I wrote.
Yeah, so excited.
So I would encourage people to read that as well. It's mostly about my own story and how I coped through it, but it's in the current edition of the newsletter.
Yeah, and don't be modest. I really like it. I was excited because obviously I know it went virtual, but I'm old school. Well, my mom's more old school. She likes to read the newsletter in person, so we read it together. So I was really excited to see that. There's another question I want to get to in a second, and I'm hoping that we'll have Robyn back. There may have been technical issues, but I just wanted to ask you, kind of bouncing off of that.
Sorry.
Scott.
There you are.
It's okay. I'm telling you, it's that New York Wi-Fi. You guys have too many people.
Sorry.
No, I'm just kidding. But Scott was just talking about, real quick, the latest IOCDF newsletter, which I have somewhere around here, has his story. So maybe really quick, Scott, what did it take for you? And we can talk about it before we get to the next question. What did it take for you to open up about body dysmorphic disorder? Because I think, and tell me if you guys disagree, but I still think BDD isn't getting the attention that it deserves. I don't think people really fully understand. I know the International OCD Foundation has been great. They've made sure there's BDD talks at their conference. They're doing things like this. It was just in the article. But they can only do so much. And I think we always can be on the ground advocates, and you opening up about your story is powerful, Scott. So for you, what was it like to open up and kind of put your story out there, as well as doing something like this, having people find out about it?
Well, when I first began showing symptoms of BDD, it was 1973, which I think was about 13 years or so before BDD was even a recognized diagnosis. And so I suffered with it a very long time before even recognizing that this was an actual problem. And then when I first became involved with the IOCDF, which was the Obsessive Compulsive Foundation back then, I believe I was the first person to ever speak at one of these conferences about his story, about BDD. And I found it, and the main reason I did it is that there was so little information out there. And I knew that there had to be other people struggling like I was. And frankly, it was also very therapeutic for me to be telling my story. And I never, even to this day, have gotten an ounce of criticism for opening up. If anything, what I hear from people is what a relief it is to hear that there are other people who are talking about this. I also want to share that when I was first giving these speeches at the conferences, the IOCDF was great in allowing me to do it. But at the time, we might have these presentations where maybe there were 10 people in the audience or 15 people in the audience. And once, Chris, you and I started doing this, and Robyn and Mandy, and last year, Thomas joined us on one as well. We've had like 100 people or so at these presentations. And so it's grown dramatically. And I agree that the awareness of BD has grown dramatically, but we're nowhere near where we need to be. I mean, I'd like to see awareness of it really continue to increase, which I think it will. And I think, the efforts that we've put in have had something to do with that.
Absolutely. And how about for you, Robyn? I know, like Scott just mentioned, you've spoken at the IOCDF. You've also been very open on social media about having BDD as a clinician yourself. Maybe just a little bit about what it's been like for you to open up, and maybe I like some of the points Scott made. What do you think's kind of next? What do you think can help BDD get out there more?
Well, I think about how my life was affected by it. And I think about when I look at my clients that are in their early 20s, and I think about how I wish I had certain treatment, or even when I was a teenager, that I wish that was there. So I look at what we have out there right now that's giving hope to people at ages that I still was undiagnosed, or thought that I had just depression, or just thought that I was repulsive looking and thought that this was just who I was. About sharing my story, I think it helped because a huge part of BDD is shame. So much of us are dealing with our disorder in the privacy of our own home, and we're not wanting to share that. So I felt that it really took the barrier down and the wall down by sharing. It was hard. I started slowly by sharing it with boyfriends and getting their feedback, and wasn't always so positive. But then I finally realized that it was time that I was honest about what I was dealing with. And I felt a sense of relief, and I felt like, okay, I'm not hiding anymore. But when I look at what's out there, I still feel that we have a long way to go. I think we still have to get out to doctors' offices. We have to get out to plastic surgeons, dermatologist's office. You have to understand that a lot of people with BDD, they're not coming into our offices first. They're going into other places. And so we need to get those places up to date with what's going on. And so it's, I think the conversation needs to be out there. I've noticed also the word is out there, but people are using it not in the exact right way. So you'll see celebrities saying, I have body dysmorphia, and they do not have this disorder. They don't struggle with what we've struggled with. They don't not leave their home or feel like they can't live their life because they don't look a certain way. And so I think that actually scares me. I think it's great that it's out there, but I think that we have to get the right message out there, because it's not just about, okay, I don't like how I look today. It goes deeper. And so I think I think the IOCDF does a tremendous job, but we still have, more to do. And I hope that it changes. I would like to see more change in the next 10 years. But I definitely feel that the community is getting stronger, and just by being able to share. And I think one last thing, I think it's incredible that us as clinicians are honest about it. Because I'm sure for each of us, I'm sure it's been hard to be open about it. But I think that for our patients, and our clients really appreciate how honest we are. And I think that leads to a deeper connection and a deeper, feel for the client to actually want to do the work when they see that we've done it. And so they feel a sense of that. So.
Yeah, and Dennis, our good friend Dennis, love Dennis. He's in the comments right now, and he shared on the IOCDF. You also did a blog about BDD, so he put that up in the comments. So if people want to read that, they can definitely go see that. He also made a good point. Before I get to Tommy, you made a really good point. I think one of the things is my sister and my family will send me articles when a celebrity comes out with BDD, and we get very excited because unfortunately that's the best way. I say unfortunately because sometimes, like you said, they come out with the wrong stuff, but that's one of the ways to get it out there. But I always read the articles, and it's never body dysmorphic disorder. It doesn't fit the diagnostic criteria. It's usually they were self-conscious about how their body looked at a certain time in a movie, and they were embarrassed because of that. It wasn't like a fixation on a body part. It wasn't feeling like the body part or body parts were disformed in any way. It was, oh, I felt too heavy. And so I think that's a big thing that I hope starts happening as well. It's like I appreciate the open conversations with people, but in celebrity. But I want to not always kind of make BDD about a weight loss issue, because that does affect some people, but they don't really talk about like on my face and this body part, etc. I always forget his name, but there was a gentleman who's an actor in Modern Family. He played one of the character's boyfriends, and he came out with body dysmorphic disorder. And when he talked about it, it really was BDD. And it was exciting to have him talk about it because it was something that I feel like we could all relate to. So thanks for that clarification. How about for you, Thomas? What has it been like? You spoke with us last year at the conference. You've been an advocate. You've been open. Like, how has it been, and what do you kind of see next for BDD? You know, kind of getting out there and
Yeah.
being more open.
I mean, for me, I'd like to educate more athletes and educate, you know, as a working with college athletics. I think that is something that could really be introduced to people and kind of normalized and less stigmatized. Because I know plenty of athletes that have come to me and have had those kind of you know, fixations and intrusive thoughts about, you know, their appearance and whatnot. And I think that I just think that a lot of times we're pigeonholing ourselves to like one specific you know, audience, and I think there's so many different people out there and different audiences that do struggle with this, and I think just more exposure and more prominence to BDD will expand people's knowledge and get the word out there of the distinction between, you know, thinking you look fat and, you know, having a debilitating disorder that, you know, can really overtake your life. Because there is like you were saying, there's a clear distinction between the two. And I mean, for me, I started sharing about BDD only last year. You know, I've spoken at 5+ conferences, but last year was my first conference talking about BDD. And I think for me, it actually has helped me, you know, being open about it and realizing that there's so many other people out there that do deal with this. And I think that even when you just get one person that, you know, resonates with your story, that has helped me tremendously, just knowing that, you know, you're not alone and you're not isolated.
Yeah, and I think you make a really good point as well. I know that for some of my clients, they are athletes, high school and college athletes, and there's a lot of body dysmorphic disorder and muscle dysmorphia in that as well. And so I think that is like an untapped resource. So yeah, thank you. I think that's something that, you know, if we can continue to make aware of all the BDD that may be in athletics, you know, I think that's a big focus on it. I know that there's a lot of eating disorders in it, but I'm sure there's a lot of body dysmorphic disorder as well. I know in my own practice that's true. So I think it's really helpful to get that word out to that community as well. By the way, Reed Ewing, he's the actor for Modern Family. I'm probably butchering his last name. Thanks for that. I'll just say real quick on my own angle. So I was kind of thrown into the fire. My psychiatrist at the time, Dr. Jamie Fusner, he had come to myself and my mom right after my BDD treatment and said, "Hey, the Montel Williams show is doing a show on BDD. Do you want to be in it? It's in New York." And I'm thinking like, "Oh yeah, it's probably in the summer or something." And he's like, "You have to make a decision because I'll fly you out tomorrow." So luckily my mom and I did that. I was on the panel with Fugan, who's big in our community, and shared on that show. And then Dr. Drew also, I did that on BDD and getting it out there and kind of being thrown in the fire. I think that's why I did it. I made it not about me. It was more so I knew struggling with it. I was very fortunate. I had a therapist who happened to have BDD herself. And when I came in for OCD, she's like, "You also have BDD. You need to get treatment for it." And she was fortunate enough to give me a referral. And I've definitely seen it grow. The knowledge out there. I think it's so important. But I know working, you know, besides being a clinician, I've worked for a while now in entertainment news media. And as a host, I mean, I'm around Hollywood all the time. I'm around celebrities. And there's just a lot of that. I mean, there's a lot of people that prey on that. We have a lot of, kind of like what you're saying, Robyn, there's a lot of plastic surgeons, dermatologists and stuff preying on that kind of mindset in LA that you have to look perfect regardless of what position you have in Hollywood. And I know a lot of my really great friends who are hosts themselves especially have pressure to, you need to get nose jobs, you need to get, you know, I hate saying this out loud because one of my friends who's a host who's Asian, they talk to her about her eyelids. You need to get that, look more Americanized. So I'm not saying they have body dysmorphic disorder, but I think as a society, we have such pressure. And those of us that do have BDD are so susceptible to hearing those messages. So I think all communities, it definitely needs to be something talked about and helped. The IOCDF also put the article about Reed's story with BDD. I want to get to another question. Kennedy Collings, she had written to us and she asked us, So she has body dysmorphic disorder. Hi, Kennedy. She says, I struggle with becoming comfortable and staying home during quarantine and then not wanting to return back to real life, such as job, school, making friends. What tips do you have for returning back to regular life once quarantine is lifted? So I think the reason this is such a good question is I think for some people, this may actually be more comforting because they don't have to be around people. By the way, I love how you guys have to like scoot up. I have the big COVID-19 covering half of my head. But no, real quick. So, I think a lot of people, maybe for them, this is less triggering because they're not having to be around people, et cetera. How do people transition back to that if they've maybe felt a little bit comfortable or safe? How would you guys suggest that people, like once this is done or things start to lift, transition back into real life?
I mean, I think one of the things that when we all have done exposures, so much of it is being outside. I remember one of my own exposures, I had to go to a restaurant and eat with people. And so now we can't do stuff like that. So maybe even doing an exposure story of some of your fears of being back out there. Or talking about some of your concerns. I mean, that's a reality I think all of us are having. Even myself, I'm so used to being home. I had a baby 4 months ago. I've pretty much been in quarantine for 4 months. So I definitely have some fear about getting back out there. But I also am acknowledging that that's my BDD and anxiety, and realize that maybe this will be a little bit harder. But again, having the support, talking to your therapist about it, the idea of coping ahead. Okay, what are some of your concerns? And what are what is that you want for yourself? Do you want to live the life where you're surrounded by people and enjoying yourself? So it might be a little anxiety provoking at first, but we're going to do baby steps. So maybe we're going to have to do some more of the, the base exposures that we were doing at the beginning. That might be a little bit more difficult for you when you get back out there. But I think if anything, it's going to show that people need to really be kind of adamant with doing their treatment and making sure that they are doing their exposures, and acknowledging that this is our safe place for BDD, but that also doesn't mean that we're living a life that we really truly want and we deserve to live. And BDD would love to live in this life, but that's not what we all deserve. So I think it's understanding that and realizing that, and being okay that this is how you feel right now.
I would agree with that, and what I would add as well is that we have to keep in mind the cognitive piece of this, and what I mean by that is that this is all uncharted territory. None of us have been in this position before. There's a lot of anxiety, whether you have BDD, OCD, or nothing at all. And when we do get to the point, which I hope is sooner than later, where we can begin to re-engage with society, people aren't going to be thinking so much about how we look. They're going to be wondering about staying healthy. Right. And so I think from a cognitive perspective, it's going to be really important to keep those thoughts in mind, is that, when we go outside in public, I doubt many people are going to be critiquing our appearance all that much.
And and what I'd like to add is it goes back to that why, it's easy sometimes to isolate. It's easy to be at home because you don't have to face the BDD. You don't have to obsess about, do people notice my flaw? Are people judging my flaw? Are they judging my appearance? Or I know for me, I just felt less than everybody else. It's hard to explain, but I felt like everybody else was like on a plane, and here I was. I felt deformed. I felt like my face wasn't put together right, and I just didn't feel adequate enough to be around people's presence. One of the really big things that helped me with treatment was just that constant need, like, when I'm doing exposures, to be around other people, because for two reasons. One, it was a great exposure, but it started to kind of tear down this notion that I wasn't worthy enough to be around people. And then over time, obviously, just having companions and friends and all that support was great. And so once again, I would say it goes back to that why. There may be some things that you're getting out of staying home right now, but really listing out, like, what were some of the things you were doing pre-COVID that you really, really enjoyed? And maybe it was tough to get there, but whether it's, being out with friends or going to school, or what do you like about your job? I think it's important to remind yourself. It's easy for us to forget, but all the benefits and the good things about pushing back against the BDD and what your life can look like if you do so. How about you, Tommy? Do you want to weigh in? Like, how do you think once this is done for you as somebody with BDD, how are you going to kind of push yourself to make sure you go back out there into your routine and not let some of the comforts of isolation and not having to worry about appearance as much? How are you going to push back?
Yeah, I just think, going back out there, like Scott said, we're just gonna have to accept that, we might look different, or we might have changed in the months that we were in quarantine, and we didn't have the same lifestyle that we had previously, so we had to adapt. And just realizing that it's healthy to change, body shape, body size, whatever your face looks like now, we had to adapt as humans, and nobody was really prepared for this situation. And that's kind of the mindset I'm going in, going when I go back out to the world, I don't think I've changed that much, but, my BDD will tell me otherwise, right? And I think that just recognizing that, that's my BDD saying that. And like I said before, deciphering the rational and irrational thoughts, making sure that, I'm still with my hierarchy. I'm still doing the Zoom, just because quarantine's over, I know I'm not going to stop doing Zoom teletherapy. Those are things that I know I need to keep doing. And, maybe quarantine kind of, this whole situation, I think, kind of brought me back to the basics, like I said before, and I didn't realize that because I was so busy with everyday life that I didn't realize, how much time my OCD and BDD are still taking from me, and that I need to work on more maintenance if I want to be at my best for, my athletes in grad school, for my family. Those are things that I want to be at my best for, and I can't do that without, making sure I'm having my maintenance of my BDD and OCD. So I think going out, like you were saying, Chris, going out when these restrictions are lifted, I think, one of the main things is recognizing that, like, my approach shouldn't change too much. What I've been doing has been working with my treatment, and I think that will carry into me, going out and trying to adapt to, lifestyle outside quarantine again.
Yeah, and one big caution I want to make too is I really am trying to reiterate to my clients, like, when this is done, I don't want people to jump back into maybe some like my clients they're athletes. We've had to work on that because they're just like you said it brilliantly. I have one client, she's like, I don't want, when this is done, for people to see me for months because I'm not able to work out to the same level that I normally can. I want to make sure that I can get into the perfect shape. I can get my skin perfect. I can get my hair perfect, and then see people. And that's a caution I want to throw out there as well, is I don't want individuals with BDD to think that as soon as this is all done, that it's smart to then go and, like, kill yourself at the gym or go straight to a dermatologist and get all these different appointments.
No, but I want to.
I mean, you want to go, or should I?
No, you could go, and then I'll go after you.
Just to add, like, some science-based fact into it, because this is what I study, and the outcome is we are all, anybody that trains or works out is gonna be detrained unless they had a home gym or the proper stuff to use. And we may do with what we had, but just remembering that it's okay if you're at a point where you weren't before this all started. That's physiology and kinesiology. That is science-based fact. You are going to be detrained, and that's, if you're an athlete, that's okay. You'll get back to where you are.
Yeah, absolutely. I'm glad you said that. It goes back to the key component of treatment: acceptance. I mean, I remember when we were on a panel together, Robyn, you were like, radical acceptance, and it's very true. It's remembering that we're all in this together. I don't know about you guys, but I canceled summer bodies this year. We don't have to worry about it. But no, it goes back to that mindset of, everybody else is going through this as well. Sometimes we can feel like only our appearance is being affected and nobody else's. But remembering that that acceptance, like, this is the best I can do with what I'm given, and it doesn't suddenly now mean that I'm less of a person. My friends aren't going to suddenly abandon me because of the fact that I haven't been working out. My value isn't any less. I can't be a great sister or mother or whatever. I can still do that regardless if BDD is telling me I can't, because my appearance looks different. I have a client that can't go out as much because they're working from home and they're not getting as much sun, so they feel pale and their skin is showing more things. And it's reminding her, like, that's not why your family loves you. That's not why you have your job. BDD tells you it's the most important, but it's not. You're going to say something, Robyn.
No, I think this just keeps popping up at me, that obviously, yes, we've all haven't had the gym and going to certain things, and maybe people that are still getting skincare treatments. But I think a big part of this is that people with BDD, our brain does not perceive things correctly. So I think it's important to realize that when we go back out there, we may feel that we look completely different than we did before this pandemic, but that's oftentimes part of this disorder. Our perception is incorrect. So I think it's important to also say that the extent of how different we're going to look is also part of our disorder and part of the BDD. I would venture to say that most of us don't look completely that different in the next 2 months when we go out there. And I think that's important for people to realize that their BDD is going to tell them the 2 months out of working out or the 2 months not taking care of their skin is going to have this radical shift in how people look. I'm not saying that obviously if you work out every day, it's going to be different, but the extent that one feels they look so different is often more related to the BDD and the perception than it is really in the reality of things. And I hope people realize that their BDD is going to say something than what's actually happening.
Yeah, that's why I think it's important to separate ourselves from the disorder so we can recognize just if we're getting messaging, it doesn't mean that we follow it 100%. I'd like to introduce another question. I think it's really good. We can start with you, Scott, if you'd like. Charles asks, he himself has OCD, but he says somebody close to him also has body dysmorphic disorder, but doesn't believe they have it. What can I do or say to make them more aware? So what is maybe some advice? We could start with you, Scott, if you'd like. If somebody watching this is like a family member, a friend, a loved one, what is the best way that they can either support or give information, et cetera, to make somebody more aware that they could potentially have body dysmorphic disorder?
Well, as you know, Chris, this is a big issue, whether it's the pandemic or not. As therapists, we're always dealing with this issue of, somebody who doesn't feel like they have BDD when they're showing obvious symptoms of it. What I tend to do is encourage people to, read some of the material that's out there. We mentioned some articles previously. I think that's a good place to start. There are some very good books about BDD. There are some videos on YouTube, and so I think encouraging people to take a chance and to look at those items first would be a good step to take.
I like that. I think a lot of times if people present factual stuff, I will shout out our live stream right now. Definitely send them this live stream. But I agree with you, Scott. I think sometimes when people get factual information, it coming from maybe a friend or a family member, they might dismiss it. But when they read, articles that point out different ways that BDD may show up in someone's life, I think sometimes it's a little bit harder to deny it. And maybe for either you, Tommy, or for you, Robyn, let's say somebody maybe is admitting it. They follow Scott's advice, they end up getting that information, but let's say they then are resistant to treatment. Maybe they think they more so need a plastic surgeon, or they need a dermatologist, or they need to just fix their appearance and they'll be happy. How do we also kind of show them, maybe as a support system, that it's important to get evidence-based treatment for BDD?
I think also that's sometimes when our personal story can come in as well. I used to think that if I just had clear skin or I looked a certain way, I would be happy. And oftentimes I wasn't. I've not had any invasive treatment. I actually had a laser treatment years ago, and it actually caused me to relapse. And so I feel that I think some of that information is there. I also acknowledge and try to tell people I understand where you're at if you're not ready to accept it, but trying to keep the dialogue open between the therapist and the client, and just trying to have them postpone maybe any big surgical procedures or any big things, because oftentimes we all know that there's a lot of regret with that. And so, but also, I think reinforcing and understanding where they're at. You can't push someone to finally be like, okay, this is BDD and this is not a physical appearance concern. This is a mental health issue. I think people have to get there. So I always find, for me as a therapist, I'm have a non-judging environment. I try to work with them, obviously never reinforcing or trying to have them go for any of those outside treatments. But I feel that they have to get there sometimes on their own space. So obviously giving them material to look at, but acknowledging where they're at and understanding that.
Absolutely. And how about for you, Tommy? Like, what worked to make you open and willing to go to treatment for BDD?
I think my experience was a little bit different because I was never really resistive to treatment because BDD and OCD had taken over my life so completely that, I didn't love going to ERP therapy, but I realized that I had to get help and that I wasn't going to be, alive, let alone living a functional life if I didn't get help. That being said, I think that like Robyn explained, I think, touching somebody with your personal story, I think that will resonate a lot one-on-one with people. I can't even imagine how, your patients feel, when they realize that you did the work. I mean, that's probably an incredible connection that you all can make as professionals, and that can really motivate somebody. I think that also, if you have a friend that was diagnosed with BDD and recognizes that they have it, I think showing your success with not plastic surgery but exposure therapy and evidence-based treatment for BDD can kind of help them, guide them in a right direction.
Absolutely. And I think finding the right clinician, I know for me, my path was different. I didn't, I wasn't struggling with BDD and then saying, I need treatment for BDD. It was, I need to fix my skin. I need to fix my nose. I need to fix my forehead. And then I'll be happy. Like you were saying, Robyn, it's such a trap. I still to this day kept it, but I had a journal, not a diary. It's not manly enough. I had a journal. But I wrote in the journal, like all the things I needed to fix. I needed clear skin. I needed to lose weight. I needed to be in shape. I needed to be tan, my hair, blah, blah, blah. And then I could be happy. And so for me, it wasn't that I was resistant to BDD treatment. I just didn't even think that it was what I needed. I needed to do these things to fix. But it wasn't until getting in front of somebody who was a specialist, who really understood the disorder, treated the disorder, and really, really knew what they were talking about. So I was finally like, oh, everything that they are saying is me. Like this person either like spies on me at night or I have this because this is everything. So I think that's important too, is getting someone in front of a clinician that they really trust, who knows and understands it. I think that's a key too.
Chris, what I would add to that is that for somebody who needs therapy but denies that they have BDD or rejects the idea, what I often encourage families to do is focus instead on the suffering. And on the feeling depressed, because there's no debating that issue. There's no debating, that the person is suffering. And I think sometimes that can be the hook to get somebody into therapy. And then once they're in therapy, then it's the job of the therapist to work on the BDD part. But at first, to sort of even let go of the idea of the debate of whether somebody has BDD or not, because sometimes that can be a really losing battle. And instead, just sort of acknowledge that, we know you're suffering, and let's get some help. Let's get some help for that, and then take it from there.
Absolutely. That's a good point as well. And sometimes I always tell family members and loved ones, they can also get treatment. They can also see a specialist just to know how to best support, what things they may need to pull back on, but best ways that they could support someone. I know we have a couple more questions, but I know we had kind of brainstormed some really hot topics before, and I know we don't have the most time, and I definitely wanted to bring this up. We kind of addressed it a little bit in the beginning, we had mentioned it, but I definitely think right now one of the biggest things that I'm hearing from my clients is around social media. So I'd love to open it up to that, because besides, I think we addressed the struggle of doing telehealth and FaceTiming family and friends because you have to look at yourself. But one big way that a lot of people are communicating with each other right now is social media. And maybe somebody who wasn't used to posting as much or didn't go on social media that much because they're so busy, who's now on it a lot. Maybe you can start, Robyn. How has social media affected you during this time, and how are you seeing it affect our community?
It's funny because for a while I stayed off social media. For me, social media can be triggering, and I find that for clients as well. There's so much comparing, such a huge part of BDD. We compare how we look to others. But even when I did the presentation with you guys, we talked about how people show themselves on social media. A lot of times they'll use Photoshop, they'll use different apps to change the filter. So I try to remind myself and remind my clients that when we're looking on social media, we're not necessarily seeing a person comparing exactly the same. And learning, and obviously in dealing with the pandemic, there's some benefit to being on social media because you can stay connected to people. So it's about, okay, we're going to use this platform to stay connected to people. We're not going to use it to trigger ourselves or to get ourselves into that BDD kind of mindset. But social media is definitely triggering because there's also a lot of ads that come up for different procedures. There's a lot of ads about cosmetic treatments. And again, just people comparing how they look to other people, and maybe themselves going back to their old photos of themselves and saying, okay, how have I changed? And so I think, being aware of this and talking about it, and knowing if it's something that truly is too triggering for you or not. But, knowing that a lot of people are using this as a way of communicating and staying in touch with people.
Yeah. And I just want to, why don't you go, Tommy?
No, I was just going to add that I think, like Robyn said, it's they use Photoshop, those kind of things. I think it's important to remember that when you're looking on Instagram or whatever social media you're using, that we're looking at oftentimes the highlights of people's lives, right? Not many people post, just woke up and it's them looking grungy, and I mean, I do. So, you know what I mean? Though, there's a difference between, comparing yourselves to a likewise person, but you're actually comparing your normal self to someone's best self when you compare yourself on social media. So I think that's one thing to remember, that why social media can be so tricky. As much as it has so many good beneficial factors, we are seeing the highlights. Nobody's posting random things that, they want to post things that people are going to like because everything's so like driven and content driven. We're seeing the highlights of people. So it's just important to remember that, they're not always like that. And, you can't compare yourself to someone's best all the time.
Yeah, and I wanted to say, I think one good thing, because you guys made really good points. I mean, that's the hard thing with social media, is you're seeing everything is filtered, everything is highlight reel. I will say, I think the one good thing that I'm starting to see in social media, because we're all universally struggling right now in our own ways, is I'm seeing more people be a little bit more honest. Like, hey, I'm having a really hard time today. I'm really, really struggling. Even if they don't have body dysmorphic disorder, OCD related disorders, etc. I'm seeing people be a little bit more open, even if it's just like, hey, I'm really bored today. Because I think so much we are programmed on social media and in general to be nice and kind and positive. And so I think, some people are definitely, putting that out there more often, like talking and discussing how they're struggling or not doing well. I think there's also like a lot of really, really good advocates that are stepping up and providing like Instagram and Twitter and Facebook events like this and support like this. So I think it's really good to see people step up for the community and to use social media and to use, we're using social media right now, we're using Facebook. And I think the IOCDF has been utilizing social media and online presence to really up it right now during these times. So I would definitely say that that's important, is just recognizing like how social media has actually been helping. You guys are completely right, though. It is not great. And I think for me, it's just definitely, I have on my phone, I have a timer. I only let myself go on it for 15 minutes at night because it is easy.
Awesome.
It is easy to get caught up in it. And that's one thing that I work with a lot of my clients with BDD, is because right now they normally would be comparing when they're out in public, but now they're using social media to do the obsessive comparing and looking at other people's skin. And neither is good. But I'd prefer somebody doing it. If they were going to compare, I'd prefer it in person, because on social media, it's edited and it's filtered. So that's something I think for our community, it's really important to definitely make sure that we are not letting ourselves suddenly come up with new compulsions during this. Scott, I want to get you for another question. We just got a question right now, and I think it would be good to kind of clear it up. Sorry, Jess, I didn't copy and paste it, but it's the recent comment from Jennifer Claycomb. She asked, I've never heard of BDD, but I did look it up. Does everyone have that? So maybe, Scott, you could address that. Is BDD something that's extremely common? Does everybody have it? Or is it something that's a little bit more rare? And how can people tell the difference between just common image concerns and then body dysmorphic disorder?
So we have another hour and a half, right?
Yes, the IOCF said just go forever.
No, not everybody has BDD. Granted, everybody has their own appearance concerns. That really goes without saying. But we have to really think of this in terms of the suffering that's involved. When everybody, we know the expression having a bad hair day, and everybody has that on occasion. But it's only somebody with BDD who has a bad hair day and thinks about not going out at all or not going to work or gets very depressed or even thinks about suicide. And it's really at that point that we have to consider the diagnosis. And, the amount of disruption in someone's life, the amount of time they're spending doing grooming rituals or putting on makeup and avoiding doing things that most people would. And so, I mean, in truth, it is an important question. I mean, everybody has some kind of appearance concerns, but it really is the level of dysfunction and distress and despair that it causes that makes for the difference.
Yeah, I definitely want to get both of your opinions. I actually want to thank Jennifer for that question. I think it's important because that's kind of what our community deals with. I think there's a level of, I know at least in my own life, there was such a level of fear and shame because that's kind of what I felt everybody else thought is like, well, I don't like everything about my appearance, like get over it. And I know for me, like a huge part of my recovery was deciding to go into news media and being on camera and interviewing celebrities and always being on camera and then having to watch the playbacks and look at my face in every different kind of angle and stuff. But for me, especially before I got a lot better, I mean, it was crushing. Like, I would come home and just cry and be like, why am I doing this to myself? It feels like torture. I don't care if it's a dream of mine. We need to quit. But it killed me at my soul. And then before I got treatment, I mean, it was to a point where I felt less than human. I had a horrible suicide attempt in 2002 because I just did not want to live. That's how much of a freak I felt like. And so I think it is important to ask questions like this because I think it gives people an opportunity to really understand, like, everybody that I know in the community, clients and you guys, when we talk about our stories, I always want to give you guys a hug because I just know the pain and the difficult our life was. And then obviously we feel shame and guilt because it's like, oh, it's just my hair. I should just get over it. Why do I want to kill myself over my hair? But it's more than that. I mean, I think we don't feel human. So maybe Robyn, you can kind of weigh in on this.
So I think that what we have to come to a realization, and I talk about with clients, is that appearance is something people look at. I don't want to ever say that when we're doing treatment, like appearance is not important at all, but to the extent of how we view ourselves, I think someone with BDD, they don't feel like they deserve to live or to be happy, or they can't find their way in this world when they're feeling this way or when they have these concerns. And I think most people who have appearance related concerns, if they have a pimple on their face, they'll cover it. Maybe they won't have a great day. But someone like myself, I missed my entire first semester of my senior year because I couldn't leave my house for a month. I felt so repulsive and I felt like I didn't deserve to be out in this world. I don't think someone who has just a regular appearance concern, it goes deep down. I thought that I didn't want to live anymore. I didn't know what to do anymore. I couldn't imagine living this life feeling this way. And even at that time, I didn't even get that diagnosis until 2 years later. And I remember sitting in a therapy group and saying, okay, I can't leave my house. And the person next to me says, well, you should be ashamed of yourself because this other person lost their wife of 60 years and you just can't leave your house because you have marks on your face. And I felt like, oh, then something's wrong with me. Like, then this isn't a problem. And so I think what people don't understand is that BDD for me, it wasn't just a skin issue. I felt like I wasn't worth it. I felt like I didn't deserve to be in this world. And I don't think if we could speak to other people that just have appearance related concerns, I don't think it goes that deep. I don't think it goes deep like they don't deserve, people shouldn't go to their work. People shouldn't see how they look. So I think that those are very big differences. And I don't think people that just have basic appearance concerns feel like they want to kill themselves. And this disorder, over 80% of people have suicidal ideation and 1 in 4 attempt suicide. That's tremendous. And so it's a huge number. And, talking about it, it brings me back to the pain, and especially thinking about all of us being in the house right now, and I'm in the house where this happened to me. So it's definitely something that people do have appearance related concerns, but I don't think it gets to this extent. And I think you have to see how it's impacting your functioning. And most people that don't like how they look, they're still able to function, and they're still able to live their life. And I could say that I'm sure all of us have felt that we couldn't live our lives in our worst of this disorder. And I don't think people with regular appearance concerns usually get to that state.
As far as the numbers go, I just want to mention that, a lot of times people think of BDD as a rare disorder, but depending on what you read, there may be as many as 5 to 10 million people in this country who have BDD, which means that it surpasses OCD. And so there are a lot of people with this disorder. And so it certainly is not a rare problem at all. One of the problems, as Robyn mentioned earlier, that there's so much shame associated with it. A lot of people aren't coming and getting the help they need. They're oftentimes instead going to see dermatologists and plastic surgeons. But this is by no means a rare problem.
Yeah, and just to kind of add to what you guys have been saying, I mean, I remember as young as a little kid, like I was in second grade, and while all my friends were playing on the playground, I had snuck like a comb and a brush to school, and I'd go to this bathroom that nobody was in and just spend my whole lunch period like and recess combing my hair because I didn't want it to leave look imperfect. Just like you, Robyn, I almost didn't graduate high school because I could barely go to school. I dropped out of college. I quit work. I housebound for 3 years, suicide attempt. I completely isolated myself from friends and family. And it was more than just my skin. I mean, yes, obviously, you know, skin, hair, et cetera, that was it. But to me, like you said, I just didn't feel worthy. I felt like nobody would miss me if I was gone. Nobody would care if I was supposed to you know, if I was going to die, because I just didn't feel like I was on the same plane or level as people. And it's just, yeah, I look at my little kid self who was just, I mean, I remember in high school, just hating being at school, wondering why we couldn't have school at night, because then there'd be less sunlight and my skin wouldn't look as bad. I mean, these are the things that I was struggling with while being a teenager and turning to alcohol and drugs to try to self-medicate. And that didn't work. And, you know, it's just the level of pain that runs through it. So, you know, I hope people can really take away from this is just that it's more than just us caring about our appearance. I know, you know, a lot of people care about that, but I think if all of us had another hour and a half to just go into the ways that it like affected our personal lives, I mean, people would really see. And our stories aren't unique. When you meet people with this disorder, their stories are very similar. How about lastly for you, Thomas, like how maybe has BDD been different for you compared to maybe people around you that have image concerns? Like how has this disorder really affected you as a person at your worst?
Yeah, I mean, I think, you know, quickly just to add, because I know we're short on time, you know, I think that, like we said, you know, it goes deeper than, you know, I just have an ugly pimple on my forehead. You know, I think that, like Robyn said, it's a lot about, you know, you don't think you have self-worth, and, you know, that can really tear you down. And I think that is what happens when you have BDD oftentimes. And I think, you know, the way to decipher that is it's very similar to OCD, right? You know, some people might check something once, but it's not debilitating their day. Whereas, you know, they might have some kind of tendency, but it's not debilitating their day. Whereas, you know, people with OCD are, you know, I know at my worst, I was, you know, 14 to 15 hours a day doing compulsions. So, you know, there's just a line that, you know, one takes over your life and one, you know, you're able to live with. So without any treatment. So I think it's just remembering that, you know, it goes deeper than, you know, I don't like the way I look today, or, you know, my hair's flat today, or whatever it is. You know, it goes deeper than that. And I know for me, you know, especially when I was at my worst with my OCD, I think that, you know, I didn't go to, you know, school was iffy, and going into school, I felt that I couldn't even get myself ready for school. So when I went into school, I hated my appearance. I looked tired. I had bags under my eyes. I didn't look like, you know, a well-functioning person. And I think that kind of made me shy away from meeting people and making friends in high school. And I think that's how BDD really affected me in high school.
Yeah. And like I said, high school, you're already trying to fit in, and now you're dealing with BDD on top of it, making you feel like even unworthy to be at school because you look tired, et cetera. I wanted to thank again, Jennifer, for that question. I think it really kind of brought it. My feeling was it brought this whole live stream full circle, and I hope people really leave kind of understanding what this community goes through. And, you know, somebody had said in the comment, it helps them understand their daughter. And I think just the more people in our community, the more the media. Jennifer made a good point. She said part of the reason she kind of, you know, felt this way is because of the way that the media portrays it. So I'm hoping that the IOCDF and us on a local level and a regional level, et cetera, can keep getting out there what it really is. As we wind up, we're running to the end. Just really quick before we say our goodbyes, I just wanted to see if each of you guys wanted to say a quick, like, you know, word of encouragement or hope, or a point that you hope people really take away from this. We could start with you, Scott.
Yeah, one of the things I'll add is that I'm about 6 weeks overdue for a haircut. And I know I've probably got a month left to go. And my wife and my daughter keep on telling me, "Oh, I'll cut your hair." Not going to happen. So one of the things that I just want to mention is one of my concerns. I don't mean so much haircut, that's part of it. One of my concerns is that I really hope that people aren't spending time trying to research home dermatologic treatments, or worse yet, home plastic surgery. Please don't do that to yourself. I mean, I've seen a lot of people do that kind of thing and wind up with disastrous results. This is going to end. I mean, at some point, this pandemic is going to end. We're all going to be able to go back to our normal lives, and we just have to hang in there a little bit longer. And, I want to encourage people to be proud of themselves for hanging in there during this time. This is an incredibly difficult time, whether you have BDD or not. And especially with BDD, it makes it even that much more of a challenge. And so be able to hang in there and being proud of yourself for doing just that, and be proud of yourself for attending today's presentation.
Absolutely. Thank you so much, Scott. How about for you, Robyn? Any final thoughts?
Just that I want people to know that they're not alone, that other people suffer from this, and that our worth is not just in our appearance. And part of treatment is about finding your value in other things unrelated to your appearance, and finding yourself, what you do in this world, and that you can live a healthy and happy life with BDD. And I think we're all examples of that. That doesn't mean we don't struggle, but that there's the right treatment, and that the IOCDF really pushes that. And I just want to thank everyone for that, because it wasn't out there when I was struggling. And I'm sure that it would have changed a lot for me and my family. So I want to thank that.
Absolutely. How about for you, Tommy?
Yeah, I mean, similar to Robyn, realizing that, part of treatment is kind of creating your identity outside of OCD and BDD, and realizing that, your worth goes deeper than your looks. And, like Scott, I'm not letting anybody else cut my hair. I tried three weeks ago. You can't tell. It ended disastrously, and I came downstairs, and I think I made my mom cry, and and so just realizing that right there I had a slip up. It's okay that if some days are worse than others, just keep pushing along and realizing that you're on the right track when you're in treatment.
Absolutely. Before I say my closing, I first want to say I've been able to read the live comments, and I got to as many questions as we could. So if we didn't get to your question, I really, really apologize. But besides questions, we had a really, really good amount of interaction and great comments. And I want to thank everybody for their comments. Really, I want to thank Susan, had messaged that her 12-year-old daughter has this. That's part of the reason I do this, and I think all of us on this panel does it. I mean, we want to catch this young. We want you to get as much treatment as you can early on, so you don't have the years and the decades of struggles like most of us did. But I want to thank everybody absolutely for your really sweet comments. It's really important to us that you guys took the time for that. Also, in the comments, there was a lot of really good resources that the IOCDF put up. So please check out the books and the links and stuff like that as well. And then I just want to, of course, say thank you to the International OCD Foundation. I think it's great that we can have something like this and really tap into the body dysmorphic disorder community. And there may be somebody out there who sees this for the first time and really decides to get treatment or help for that. So I would encourage everybody watching this, please share it with family and loved ones and other people you think would really like to see it. If there's enough interest, there can be a part 2. We had like 12 other hot topics we didn't even get to. So we definitely have more to cover. So if it does well, we may have a part 2. So we need your help. Spread this, share this. It's really important. I just want to say, hang in there, you guys. Like, I know this is tough right now for everyone. And I know for the body dysmorphic disorder community, if you're an individual or a family member with it, I know it's especially hard because the haircuts, like we talk about, and like not doing skin routines and stuff. And like we talked about, for people and individuals with this disorder, it feels life-changing. It feels like the end of the world, and it feels like we're not worthy enough to function because we can't get these certain things done. So I know it's really hard. So please open up and communicate with each other, support each other. If there's people in your life struggling with this, just check in on them and see how they're doing. But there's hope. The 4 of us have gone through treatment. We're doing exceptionally better from when we did when we first started. So there is hope. So please do that. I want to thank you 3. Thank you guys so much. You guys were great. You were amazing. You were knowledgeable. You were open. It was incredible. Thank you guys for being here today. I really appreciate it.
Thank you.
My pleasure.
All right. So thank you guys so much. Of course, thanks to our panel. Thanks to the IOCF, everybody in the comments. Jeannie said part 2. I agree with her. Let's see if that happens. But thank you so much. I think it's incredible that we had this opportunity. So thank you, IOCDF. Please share this. And I do want to say before we go, even if you only have BDD, the IOCDF has been putting up really great resources for OCD, for hoarding, for BDD, for depression, anxiety, etc. IOCDF is your one-stop shop to get as much resources and help as you can. So make sure you go to iocdf.org. I'm telling you, like, they are doing more than I could even imagine that they're doing. I know the size of their staff. So they are grinding. They're putting together so much incredible resources. So please share that. It's a great place to help those who are needing help during these times. Thank Jess, thank Jeff, thank everybody at the IOCDF. So take care. We're going to say goodbye, and everybody stay strong. It was good seeing you guys.
Bye, guys.
Yeah.
Bye.
Bye.
This is where we do the